In that group, the relationship between measured cognitive function and brain pathology was broken. In other words, the social network seemed to mitigate, seemed to offer a protection against their the effects of the pathology on their brain. Thank you. So, and then if I can go back to Martinez's study here, this may look like the same slide I showed before, but it's not, because on the y-axis here, we don't see self-perception of social status. We have self-perception of social support. And what you find here is that social support, the more social support a person felt they had, the more social support that person felt they had, the higher was the dopaminergic status in the brain's reward network. In other words, we have here, just like the self-affirmation, we have a measure of social support which acts as an antidote, if you like, to the corrosive, cognitive function reducing, emotion depleting, motivation undercutting effects of low efficacy and low outcome expectations that come with the diminished status that accrues to people with brain injury. So that's two bits of good news, the self-affirmation and the social support as potential antidotes to this. So I'm just going to say thank you very much. I've summarized this work in this book, but I do really, if we have time for one or two questions, I'll be very glad to take them. But thank you again for the opportunity to present this to you.
And thank you so much for a really intriguing lecture. We're grateful for your thoughts and expertise on this topic. I imagine we don't have time for much of an exchange, but just as one last thought, so based on everything that you've presented and studied, what would be your one sentence bottom line way of facilitating the development and maintenance of confidence in persons with acquired brain injury?
Measure it explicitly and then target it as a therapeutic outcome explicitly, independently of specific behaviors.
Very good. Thank you so much for being with us, and enjoy the conversation.
and welcome to this Friday session that is going to be an absolutely wonderful conversation with some brilliant Black women. My name is Nneka MacGregor, and I'm going to be the moderator today. I want to start off by acknowledging that I'm coming to you this morning, this beautiful Friday morning, on Indigenous land in Toronto that belongs to the Indigenous peoples, the Haudenosaunee, the Huron-Wendat, the Mississaugas. And in honor and respect for Indigenous people and their land, I do my work as an ally, as an accomplice, and constantly in solidarity for the rights and humanity of Indigenous peoples. Today's session is going to be a discussion around traumatic brain injury at the intersection of race and gender, understanding the experiences of Black women survivors of traumatic brain injury in accessing medical support. We're going to have a very full and authentic, free-flowing conversation about the impact of systemic racism and how it significantly impaired these panelists' ability to be seen, to be believed, and to be treated by TBI professionals and the overwhelming majority who denied them treatment. I think it's important to also look at the implicit biases that impacted the perceptions that plagued individuals about Black women, and how, because of these perceptions, our panelists were denied access to treatment. We're going to unpack how differential outcomes for these Black women survivors, whose experiences mirrors so many of other Black women across North America. So I'm going to welcome you all, welcome the panelists. I am so excited. I am so excited and so honored to be in the presence of some beautiful, brilliant, bold, audacious Black women. I'm going to introduce them alphabetically. We have Daneen Brooks, we have Davine Mason, we have Courtnee Walker, and Erica Renee Walker, and I did it alphabetically. So, my sisters, welcome. How are you feeling? You're all on mute. Yes. There we go, there we go. So my first question is really, I'm going to go around to everybody, but we're going to do it alphabetically. I'd like you to share a little bit about your journey with traumatic brain injury and how long it took before you received the diagnosis from the medical profession. Starting with Daneen. A little bit about your journey.
My journey was a long ride, honestly. It started with a car ride to come to work that morning. I remember it was a beautiful morning in October. The sun was shining. I was ready and excited to come to my campus to work with my students. And I was at the light right before entering campus, and I was hit from behind. And the only thing I remember about that car accident was I heard confusion, being hit my head. And I remember being put on an ambulance and going to the hospital. I felt dazed, confused about what happened. I had never had a concussion, so I didn't know what was happening. So I was out of it for a little bit of time. And by the time I came through and got to the hospital and said to follow up with my doctor in a week, and during that week I should just go home and rest. When I went back to my doctor in a week, I was still having severe concussion headaches that radiated. And I kept going back to the doctor's office for follow-up, at the time that he recommended. And long story short, it took me telling my doctor time after time all the symptoms I was having in terms of ringing in my ears, blurred vision, to the point where it looked like a microscope. The vision was that bad. I couldn't concentrate. I couldn't focus. I was actually going through the tenure process, and I wasn't able to teach class in the way I did before injury, and function in a classroom and engage with my students. It became more difficult to the point where I got vertigo and I ended up in the hospital a number of times, and taken by ambulance. So with these vertigo episodes and being in the hospital, the only thing they did for treatment was really just to hydrate me and send me home and tell me to follow up with my doctor. That went on for 5 years. And that's a little bit about the process of being diagnosed, was feeling like I wasn't being heard or listened to, having my symptoms dismissed in that process, and also feeling very isolated because I wasn't getting connected to resources.
Wow. Wow. 5 years. 5 years. Davine, my lovely, how are you?
I'm here.
Same question. Share a little bit about your journey and how long it took
Sure.
before you got the diagnosis.
Well, the reason why I'm even here is because I got mine behind a domestic violence incident where I was hit over the head and knocked unconscious. And shortly after that, I began having seizures behind this. And of course, taken to a neurologist to be put on medication. And I believe I was put on some kind of cocktails because I just kept having these seizures. I've never, ever had them before in my life. At this point in time, I was 27. So up to 27 years with 3 children at this time, I've never, ever, ever had one seizure. Headaches, when I say headaches, these weren't normal headaches. I'm talking about every single day to the point where they were like blinding. No type of medication that I could take was getting rid of these doggone headaches. So keep going to the doctor. The medications that they were giving me weren't even controlling these seizures. At one point in time, I was having 5 to 6 seizures a day. Imagine constantly going to the hospital having these amount of seizures. And at one point in time, I was taking literally 16 pills a day, and they were not controlling these seizures. And it was like, I would go to the emergency room. All that they were doing was putting an IV in me, giving me something to keep me hydrated, and then sending me back home. I was doing MRI after MRI, test after test, CAT scan after CAT scan, but they were still just sending me home. And then I felt so shunned because how did this happen? Oh, domestic violence. And I think it just stopped at that. Like, oh, that's how it happened. I kind of felt like I was looked down on. Once they found that out, it was just like, oh, okay. And especially going to the emergency room because I was left there so many times, being brought in on that stretcher and then just left on the side of that wall. Or sometimes when I was able to walk in, I would just sit there in that waiting room, waiting for a nurse to even when I got to the nurse's station, waiting for her to come and do I'm like, oh my God, I just had a seizure. I'm so out of it, especially after having a seizure, you're literally out of it. I'm just like, oh my God, would somebody come? My frustration is rising. Would somebody come and see about me? They're taking their time, and by the time they get over to you, they're so callous. I'm just like, really? This is just not what I expect from a medical professional. I mean, just like, it was so frustrating. And then I have children who are actually picking me up because I have grand mal seizures. So I have children that are actually literally picking me up off of the floor.
Wow.
Putting me back in the bed. I'm losing continence. They're wiping me up. They're seeing me yelling and screaming and doing all of these kind of things. At one point in time, they just stopped calling, the ambulance because they're doing the same thing over and over. So they gave up on that. I wasn't getting any help.
Wow. And you were saying that you think it was also complicated because of the domestic violence.
Most definitely. Why are you even asking me that question? What should that matter? Once you found out, and why didn't you leave? What do you mean, why didn't I leave?
Yeah.
How about ask me, how am I doing?
Yeah. Yeah. We're going to explore that a little further, but thank you so much that's intense. That is really intense. Courtnee, hey, how are you? Are you on mute?
Yes, I was. I just unmuted myself.
There we go.
Hi, Nneka.
Hi. So share a little bit about your story, your journey.
So my TBI journey has been for the past 7 years. It's now going on 7 years of my healing and this journey with TBI. How I even sustained a concussion place. I was in 2014, February 2014. I was a senior college, 24 years old, getting ready to prepare for my senior project to possibly go to New York City, audition in front of all of these with my class, my senior class. And I was going to do acting. I was also a dancer, pre-athlete as well, very athletic. And just about to start my life. And I was at home, and I was trying to look for something. I can't remember what I was looking for before I left the house. And whatever I was looking for, I was like crouched underneath like our island marble countertop table. And I was on the phone too, trying to find whatever, trying to get out the house at a reasonable time. And by doing all this stuff, I didn't clear it. And I would normally just move out the way and just get up and go. But this time I just came up, hit my head right here. And I just remember blacking out what felt like a split second to me, but my vision went black at that point. And I was on the phone with my grandmother, who is a retired nurse. She said, "What happened?" I was like, "Oh my gosh, I hit my head. I'll call you back." I remember just holding my head, and I had the most excruciating pain I could ever imagine. My vision came to my sister, who was at the house. She saw what happened. I said, give me ice. And I immediately, my vision came to, and I went to the restroom, was looking in my hair to see if there was any bleeding or a cut. Nothing was there. Ice on my head for 5 minutes, and the headache subsided, and we went on about our day. And my grandmother, who I met later on that evening at church, I was sitting with her, and she noticed that I looked a little funny, and she said, "Are you okay?" Like that. I was like, I said, I hungry or something, but my vision in and out. It was really hard for me to focus. And then all of a sudden I just started getting a massive headache again. And so me and my sister and my grandmother, we left after church, and she said, "When you get home, call me." I said, "Okay." Went home from work. She said, "Hi, Courtney." I was like, "Hey." And she was like, "How's your day?" I was like, "My head's just hurting. I'm going to go to sleep." And I literally went to sleep, and I took 2 Aleve or 2 Advil to subside the headache and went to sleep. Next morning, that's when everything changed. It was really difficult for me to wake up the next morning. My sister and my mom were coming in to check on me. They're like, "Courtney, we need you to get up." But I thought I was awake, but it was hard for me to get up. And I actually think I was falling in and out of consciousness. But when I finally woke up, and then my sister was like, "Hey, Courtney, come in and eat." And I was like, "Okay." And my movements were slow. And then all of a sudden my mobility was really like, I couldn't move. And all of a sudden I just remember like falling over and slumping over and not being able to stand. And all of a sudden, I couldn't move my arm. Like I was trying to eat, and I couldn't move this part of my arm. Then my sister called my grandmother and my aunt and told them that something's wrong. I couldn't move, and they told her to keep me moving. So we got up and was trying to just walk the floor, and all of a sudden I had violent shakes on the whole left side of my body and could not walk. I was falling over. My grandmother and my grandmother and my aunt came over. They said I had to go to the ER. I didn't want to go to the ER, but something was clearly wrong. I got rushed to the ER. They immediately didn't ask questions. They just rushed me in. And it was just very odd. They put these EKGs on me, but it was not properly, meaning like you're supposed to cover the person when you're putting those things on them, IV. And then they started doing the CAT scan, MRI scan. And when the results came back, everything was normal. And so then at this point, they're like, "Well, nothing's wrong with you, so why can't you walk?" And from there, they automatically assumed, like the doctors assumed, because I am African American, maybe I was drugged, or maybe, because I'm a student, I'm stressed out at school or something like that. And so from there on out, it was just a really, really bad experience. And just the fact for my family to see me have to go through that was very heartbreaking. I did get 2 different, and it took me a while to get into PT, OT, and speech. I finally got in, but no one really knew much about brain injuries. So from there, it was.
I'm going to stop you there, because we are going to get really, really more deeply into the process of accessing care and support. So, but hold that thought. We're going to come back to it in a minute. I'm going to bounce over to the lovely Erica Renee Walker. Tell us a little bit about your experience, Erica.
Can you hear me?
Yes, we can.
Okay. So my injury was totally different. So I was actually, it was a weekend of events. I was shot in my head on June 1st. So my brain injury is slightly different. I didn't have a concussion per se. But I know, so well, I had a birthday that Friday. I was just turned 21. And so I was in celebration mode still. And so that Sunday I had went to a gas station and I bought something to drink. And I remember feeling weird, like something was going to happen, like something wasn't right. And so and then I ended up hearing a noise, like a loud bang or whatever, like maybe like a gunshot or something. And so not even knowing what it was. And I was told I ducked, but I don't remember ducking. And so I had blacked out. And I was obviously rushed to the hospital because I had been shot, I guess. So I rushed to the hospital and I was told I had seizures and stroke and all those things along the way. And I was put in an medically induced coma. And medically induced coma, but I had a 5% chance of living. So I wasn't even aware of anything that happened. So it was all just like a blur. But when I finally, after I had 2 brain surgeries, after my second one, I started showing brain activity and come back around, I guess you could say. And then I still was not clear though, but it was a little bit more normal. And so I think at that time I was transferred to another hospital called St. Mary's Hospital. And then I was receiving therapy, but I had no idea what was going on. And so it wasn't explained to me that Erica, you were shot in your head, brain injury. I didn't hear anything about that until like 4 months later. And so I was just receiving therapy, and I was cooperative with the therapist because I didn't know what they were doing. I didn't understand, and so it wasn't explained to me what happened at all. And so I was just in the dark basically. So that's my experience.
Wow. I'd like us to explore a little bit now what it was like trying to access medical care, right? What obstacles, what challenges did you encounter as you tried to access care? And why do you think the experience that you had was the experience that you had? So let's start back with Daneen.
In terms of accessing care, I felt like care wasn't there for me at all. Every time I'd have these vertigo episodes where I would collapse and fall on the floor. My very first episode, I remember my dog at the time, who was alive, came upstairs with me and normally doesn't sleep in the room with me. But that day, Sasha, for whatever reason, came with me. And I remember waking up in the middle of the night to stand and go to the bathroom, and I fell. And I was throwing up, and my sister's a very heavy sleeper. And my dog, Sasha, she saved my life. She barked and barked and barked until my sister got there. And an ambulance came and took me to the hospital. But when I got there, they put me in, and I hear this common theme. They put me to the side. I was throwing up nonstop. I couldn't walk. It was obvious that it was pressing that I get help, and nobody helped me. I was just in the hallway up in the bag, and a nurse every once in a while would prop the bag to my face, and well, you know what? No one cared. Wow. And my sister trying to get doctors to help me, and nobody would help.
Wow.
And I'm lost in the emotion of that feeling.
I understand.
And forgot the question right now. But in terms of accessing care, it took me fighting and continuing to self-advocate to say something's wrong. Why am I now getting another bill that I can't pay for an ambulance, and I'm taking taken from work, and I didn't want my students to see me that day. I'll never forget the day I collapsed. I couldn't walk, and every time with even not being able to walk, I was never sent to physical therapy. My doctor, when I went for follow-up, gave me some exercises. It was never suggested, even though I talked about not being able to see, and my vision was blurred, and I couldn't read anymore, and I had problems with processing cognitively, all of that. It was never suggested that I saw an occupational therapist until I finally met a person who was a nurse who saw me in the hallway one time when I was looking for a vertigo episode, and she was Black, and she understood brain injury because she had a family member who had brain injury. And she stayed with me and really fought for me to get into a room so I could have privacy. And I remember just having this bag of vomit that she took care of me. She wiped my mouth. She listened to me. She asked me questions. She held my hand. She was present for me. And that didn't happen with anyone else.
Wow. I just, before we move on, I just want to say to all of you that I'm so profoundly grateful for the courage that you have in showing up here and reliving your trauma, right? But I understand that you're doing this because you see the bigger picture. You see that what you're doing will impact and shift the way the experiences for other Black women. So thank you so very much. Really, really profoundly appreciate it. Davine, what was your experience trying to access care? And why do you think that experience happened?
Kind of along the same lines as Daneen. Lack of care. Running into so many stumbling blocks, advocating for my own self. If it weren't for my family, I don't know where I would be. I was at the point where I couldn't even work. Even still, I had a seizure on my job. I'm being rushed out, and that is so embarrassing. I fell out in the file room at my job, and people were on lunch. So I was in there by myself, and they came back and they had to call 911, and I'm being rushed out, and I'm like, I came to, and I'm seeing myself being rushed out. And I'm like, oh my God, I had another one. And they really expected me to come back to that job. I was like, oh, there's no way, because that's so embarrassing. And then it's funny because I got over to the hospital. I'm not going to mention the name of the hospital, but one of the doctors, he was like, you even scared me. You have 3 more once you got here. And that was like a joke to him. And then I'm like, okay, but here I am fighting for that. That right there should be in your notes. Why have I been denied not once, not twice, not 3 times, probably about 5 times now for disability? I literally right now have 0 income coming into my home. Why? Where you would give, and I'm tired at this point, so I'm gonna say what I have to say. Someone with drugs, or they can just say, oh, I have a back problem. You stop it. Here I have documented proof, and it's over, this is 17 years now, because of something that I did not do. Literally, you have a doctor that said for himself, he saw me having these seizures. I have traumatic brain injury. I literally have loss of my memory, short-term and long-term. Severe depression, as a matter of fact, I didn't even know if I was gonna make it on here today because this depression is coming back. I mean, I'm like, my eyes are swollen because I've been crying. I was like, I'm not gonna show up. I have to, because this is something that I live with every single day. But yeah, I can't get help. I'm still going through it. I had to fight to even get the right neurologist who would adjust and put me on the right medication, or I would still be having these seizures. And sometimes Abby still have breakthrough seizures. And I only got over to this place because she's one of the best neurologists here. And thank God she had compassion. I can remember one day even blowing up on her. And she was like, Davine, you have to fight through this. If it wasn't for her actually sticking with me, ain't no time. I mean, I had a seizure behind the wheel twice. No, I have to take that back, more than twice, because God spared me. I remember times just pulling into a parking space with my kids and having seizures. Nobody but God. And then it's just like, people, do you guys think I'm making this up? Do you think I want to be like this? a whole burden has been put on my parents because they had to pick up the slack. And this is not my fault. And it just, this whole thing makes me feel worthless, even still to this day. And I don't think nobody knows.
My lovely, lovely sister, I am so proud of you. I am so profoundly grateful. I am so proud the courage that you showed, and your voice is so impactful. So don't apologize. Say what you got to say. And I'm at the stage where I actually do name names, because sometimes that's what it requires. So, but thank you so much for that. Love you. Sending you love. Same question. What was your experience trying to access care?
Gosh, that was a journey within itself. Like I kind of previously mentioned before, my experience in the hospital, I had two opinions. One doctor was saying, no, she has a concussion. She has a TBI. They said it was a mild TBI, but they said she has a mild TBI and she needs to be transferred. She needs to be transferred. I won't mention the hospitals, but she needs to be transferred to this particular hospital to see this specialist who specializes in what she's going through. They said it was convergence disorder. And as if I'm like making it up, or because it's stress induced. And they were like, she's an athlete, she'll be better in 6 weeks. So they put me in outpatient therapy. And even took me 3 months to get into the therapy place, because on my diagnosis, from what I now know, they didn't even mark down, they marked down concussion, mild TBI, but they did not write whatever, they didn't like actually diagnose it, like saying this is what it is, because it was two different opinions. And so even then I had a primary doctor, horrible, but he did not specialize in what I went through. So he a lot of the people did not even refer me to where I needed to go or what I needed to do next. So we had to get also a patient advocate involved from the hospital because of my horrible experience there, just for me to be able to get into therapy. And that was 3 months later. I can't move. I have tremors. I have memory issues, headaches, the whole list of that's under concussions. That's what I had. I had all of the symptoms and still not seeing it. And again, I know, like Davine talked about having someone in your corner. My aunt was that person for me. She pushed for my therapy. She made sure these people were on top of their stuff to still keep seeing me, because we had so much more to go. I was in OT, I was in speech therapy, I was in occupational and physical therapy, to get everything back and working. And my goal, I wanted to be back to where I was, like my athletic, status. I didn't just want to walk. I wanted to run. I wanted to dance again. I wanted to do my athletics again. And again, and one of my me, and so he was like, well, you have to, and we call, still denied. I'm a student, no insurance, still denied, because I guess they didn't consider concussions or TBIs as a disability. I'm not really sure, but I went 3 times, got denied every time. Also too, my therapist, they also tried to end my physical therapy, because after 3 years, I finally got to walking a little bit, but it wasn't to where I was, and that wasn't good enough. And they were like, well, you're plateauing. I'm like, no, I'm not plateauing. Like, this is my goal, and we haven't even reached it yet. So I would push, keep doing my best. But if my aunt, again, she's also in the medical field too. She actually got me in with a doctor, and my doctor, Dr. Colbert Threats. I will always remember her name, because she was the first person that actually was like attentive and listening and watching. She's like, no, this is what you have, and I'm going to transfer you to my colleague, who is Dr. Perlmutter, and he's the movement disorder specialist who my first doctor was trying to refer me to and transfer me to in the beginning. And even that took, I guess, a couple more years for me to be able to see him, because he's a specialist. But once I saw him, it was like a weight was lifted off my shoulder. He was listening to me. He was watching my movements, and he said, okay, tell me again how this happened. And he said, okay, I'm reading your chart. He said, you're telling me everything I need to hear. You, the patient, you are telling me what I need to hear, and I believe you. And he's like, I'm just going to let you know, we don't know enough about the brain, but we're still learning more every day. He said, I promise you, we're going to get through this together. And when he said that, I cried.
Wow.
Because it was like the first time someone actually believed me. Like, they weren't saying, oh yeah, you have a concussion, but they're really thinking something else and writing something else in the script, which was preventing me from having my care. And again, like I said, the people around you that are advocating for you when you can't advocate for yourself, which was my aunt, and shout out to her. I know she's probably watching, and I love you so much. If it wasn't
what's her name? Auntie who?
Yeah. Her name is Michelle Steptoe Clark, and
we love her.
Man, I can't wait for her to be, and she's going to be an amazing doctor. I promise you, she's going to be amazing. And I love you so much. I know you're watching.
We are here for her. We love her too. Erica, what about you, lovely? Accessing care. You're on mute.
Sorry. Sorry. So for me, again, when I was shot, I didn't know when it happened. I didn't know anything was going on. So I got to my third hospital. And so I'm just oblivious as to what's going on. I was in a coma for a month and a half. And then when I woke up, like, I just was there. I wasn't like, I was just there physically. I didn't know, like, I know people were messing with me, like, but they were trying to get me better and, you know, exercise my legs, things like that. But I didn't know, I had no idea. And so, cause I couldn't talk for about 4 months. So I'm just in my mind, just looking around, not really thinking much on it, not thinking much at all, and just laying there and just existing. I mean, they didn't take me to therapy or whatever, but nothing was explained. Like, you had a brain injury, you know, nothing was said like that. It was just like, do these exercises and, you know, just do it, basically. So it was explained to me that you got an injury, so you need to exercise and, you know, need to transition to get better and do things like that. Nothing was said to me, like I had a brain injury, thing like that. And so access and care for me was immediate at first, because obviously I was shot and I almost died. So they had no choice but to service me. But when I got home, things shifted a little bit. But my cousin, she advocated for me when I was in the hospital. She was a big, I call her the bulldog of the family. She's a bulldog, and she wanted to advocate for us. And so when I got home, things shifted, and I had, I think I had Medicaid at the time, I believe. And I was trying to get Medicare and Social Security and all that other kind of stuff. And that was kind of a struggle to get. But that was kind of my experience with hospital services, things like that.
Wow. I think we should really explore this thing about bulldogs and personal supports and advocates, right? And again, we love them. We absolutely love them because they're lifesavers. Yes. So can you tell us a little bit about what personal supports you were able to tap into, right, and rely on? This time I'm going to go backwards and actually go back to Erica. Okay. Tell us a little more about your bulldog aunt and others.
My cousin.
Your cousin.
She was amazing. Like, when I say she took notes, like, she's a note taker, everything. She wrote everything down, like everything. Like, when I woke up, when I did certain things, like everything was in the notebooks. Like, so she was very good advocate for me. And I want to say other people. I think my mother, my aunt as well. What I remember, but she was my cousin. She was definitely so she knows a lot about different things like that. So she knows all the stuff. And my family's never been through anything like this. I'm like the only person in my family that's ever been like injured and it's to this capacity. Mm-hmm. So it was all of us knew navigating this. So it's all like fish out of water, and I might even know what's going on exactly. So I'm just like out of the loop kind of, but I'm just when it's receiving like treatment or whatever. So of course I had therapy, you know, stuff like that for a few months while I was at the hospital, you know, rehabilitation centers or whatever. Once I got home, it was just totally different. I think I may have had in-home services maybe like once, maybe. So people don't see you progressing that much. It's like, oh, you're not going to progress, so what? It doesn't matter. Whether you get here or not. It's just like kind of like tossed up, like, oh, it's, it's obsolete. So it's not gonna make a difference anyway. So I wasn't given the first chance to progress. I feel like I wish I would have had like ongoing services. I probably would have made a bigger recovery process. But with Medicaid, insurances is not really the most effective. So you get in, you gotta get out. So if you're not improving to their standards, you gotta go. You gotta get out here. So it's like you're not really getting a fair opportunity to even like progress. I feel like so.
You've been very polite by the way you framed it, because I have a few choice words about your because in Canada it's quite different. Courtnee, tell us a little bit more about your spectacular aunt and the other members of your family, because the way you described it, your grandmother, your mum, your sister, tell us about the supports and how they actually helped you.
Well, for sure. I'm going to start with my aunt, my amazing auntie. Oh my gosh, like coming, like it's almost like she came out the gate swinging. I just remember she came with her clipboard, her everything, and everything at the doctor, something, because she knows medical terminology, comprehension, kind of like what you want to be here. But have you thought about this? Have you thought about this? And a lot of times she was right there by my side, along with my grandmother in the hospital. But when the doctors would like kind of shoo everyone out, they would let my aunt stay. And so she would have to explain to me what was going on. And I had no idea what she was talking about, because I've never been through anything like this. Plus my brain, it was just like, everything was so confusing. And, but she went through, like, she took notes in my therapy sessions. She even pushed when they tried to end my therapy within 3 years. In 2017, they were trying to end it. And she was like, no, she has a lot. Courtnee, you have to keep pushing. And it was kind of like her and my grandmother, because I lived with my grandmother because she had access to a lot of the handicap, it was more handicap accessible. She would always have me, both of them would always have me do home. And it was so painful to do, and I didn't like it. I would be crying half the time. I didn't want to wake up. But they would always say, Courtnee, you have to do this. Like, we have to keep going. And even though it was hard for me, and I don't think they really liked being that, person like, no, Courtney, get up. We're going to do this, because they knew how much of a struggle it was. But my sister, all my cousins that came, they and my mom, they would all take me out of my element. When I went from a wheelchair walker, weighted vest, and then walking again. But when I was just in a wheelchair and couldn't walk, and they would take me in the wheelchair and just take me to go eat ice cream or a park. And that was like wonderful, because I didn't have to think about what I was going through. I just got a chance to have fun and be myself again and laugh, even though things were kind of off kilter for me with my journey of TBI. That within itself, of people praying for me, of people and my friends and family coming to visit me, it always made my day, because I was really sad, and I couldn't do what I could do before. But they didn't look at me any different. They would just encourage me. So beautiful. All of that really helped.
Absolutely spectacular. Absolutely beautiful. Davine, how you doing, lovely?
I don't know to start with my parents or my kids. My kids were in the house, and I became a totally different individual. So it's like especially my oldest daughter, it's like she became the mother, because I had the severe depression. It was times when I literally couldn't get out of bed for days. And they would come in and check we'll take care of the twins, because then I had little ones. We'll take care of them. And they would just you want to eat? You got to eat, Mom. They would bring the medication to me. And like I said, I had the seizures. They're the one getting me up, and they're bringing me, nope, you're going to take this medication. Nope, you got to get up. You got to at least get up, Mom. They would come and pray with me, pray over me. They were just kicking it. Even now, it's my oldest daughter that's paying my cell phone bill. They're helping me take care of everything. And then as far as my parents goes, I haven't been able to work. So it's my parents who moved us into not an apartment, but a house. And they've been paying a mortgage. Their mortgage is paid. Now here they've picked up another mortgage. And I can remember being institutionalized. I had to go to a mental institute for 3 times for breakdowns. And I would look up, you got a visitor, Miss Manson. And every time I walk out, I'm sorry, guys, I'm being so emotional today.
Bring it.
Every time I walk out the room, it's my father. I'm my father's only child. And he would just sit there. My father's not like one of those to be like, I love you. But just him sitting there. And I see him. These people stood by me. And it's like, it makes me feel even more awful because it's funny. When my mom saw my children's father who did this, she was like, no. And the more she said no, I said yes. So it bothers me because I often think if I only had to listen. It's so many times because of, where my mind, I used to explode on my parents and I treated them awful, especially as, with the depression and me being sick or whatever. And never once I'd be like, why do y'all do the stuff that, and my mother's like, and I just keep telling them sorry, because I'm a mom now to see how it is. And I'm just like, if I only had to listen. And she's like, Lynn, because I'm Davine Lynette, so my family calls me Lynn. Why do you keep telling us sorry, girl? We don't have to do this. We do this because we want to do this. Girl, don't you know we love you? And it's just like that makes me feel even more miserable. But I know that they love me. And they've been my greatest support system. They used to come to my doctor's appointments, both my parents, and she would call. If she couldn't get in touch with me, she's calling my kids. How's your mother over there doing? Did she take her medication? Yeah, make sure she eats, things like that. And I'm just like, without them, they came out of retirement for us. Without them, I have no idea where I would be. None.
I love them. I love that. And again, I completely understand why they tell you stop apologizing. It's not your fault. It isn't your fault. We pick who we pick. The fact that they are assholes, and I can say that, is not it's not our fault. But it's love. It's love that moves them. And so accept it, bask in it, glory in it, because you are worthy. You deserve it.
I've got to make them happy and proud before they leave this earth.
Well, I think they are. I think they are. Look at what you're doing here. Look at what your voice is doing. It's changing worlds. It's changing lives. So keep doing it. Much love.
Thank you.
Over to Daneen. Ms. Brooks.
Yeah.
What's supposed to do?
I have a number of angels that have been around me. My first being my sister, who knocked down doors and walked behind stations where nurses were with her cell phone, calling my doctor to get help for me, and breaking down assumptions of, no, this is not a Black woman who's on drugs, who's having an overdose or anxiety. This is a woman that needs help and care. Some of my angels were my students. They would see me in the hallway. I worked for college, and they are now the professional taking care of me. Wow. So those nurses and TAs and nurse practitioners would see me and they'd say, Professor, you're here. And they made sure I got into a room to get care. They made sure that someone listened to me, Professor, and then the other nurses that were on the floor would turn to say, she's somebody. So I was nobody until somebody recognized me, and that's not okay.
That's not okay.
That's not okay. We are all humans. We should all be getting care, and we should all be treated human and with kindness and respect and listened to and heard, and ask the questions to find out why we're there.
That's beautiful. Well, let's as we're coming to sort of our conversation, I'd like to do like a lightning round, right? A minute each. of what's your call to action? What do you want medical professionals to hear, know, understand, so that the way they treat other Black women, Black people that show up in their care, get a better treatment than you did? Let's start, and this time start with Courtnee. So call to action.
Oh my goodness. Wow. There's a lot, but I'm going to say these points because this was my experience. Is African good bedside manner. You should treat people like they're human beings and not test subjects. Also to giving them referrals of what they need, because we don't know. We're coming to medical professionals to get the help that we need so that we can be cured. And also to medicine, yeah, some things, we do need medicine for, but like my doctor, was trying to put me on a certain medication, but he didn't want to because it was going to affect functions, even though it would mask the tremors on the left side of my body when I couldn't walk. So, having good judgment, really being in tune with your patients, that's really, really important. And, really having, setting some goals for them to actually, get better, not just masking the pain.
Beautiful. Absolutely profound. Erica, call to action. What do you want health professionals to know?
I like the healthcare professionals and practitioners to know to explain the severity of what's going on. When a patient is able to cognitively understand what's going on, explain it to them. Like I said, I didn't get explained to me what was all going on. I just was like getting services. I'm like, I didn't even know they were messing with me, so to speak, or giving me my legs, things like that. I didn't know why they were doing it. So I think it's explaining why you're doing the exercises or whatever, explaining it to not only the patient but their families as well. I'm pretty sure they probably talked to my family about it, but explaining to me, the person, like what's going on, because I can understand certain things. And just because I'm not talking doesn't mean I don't understand what's going on. So just give me the benefit of the doubt, I guess, and explain, my treatments. And so what's going on, not just leave me in the dark, like, because I couldn't talk. So like I had to have like a ABC board, I guess you can call it. So just explaining things like that, just explain things, what's going on.
Right. Beautiful. Sounds like common sense, right?
Yeah.
Apparently it isn't common.
Mm-hmm.
Daneen?
So I would say to health professionals, we are more than just the paperwork that's there that says the diagnosis. So for me, it started with balance, tracking, vestibular memory, the assumption or had something there. Stories here today. So let's break through assumptions and look at our own tendencies so that we can learn about the person and really listen to their stories so that we can get the correct information to get them the correct diagnosis and access care for help and treatment for everyone so that we don't miss out on potential research opportunities and potential healthcare opportunities that impact our personal, social, medical development in terms of all of our healthcare. We are social beings and we have faith-based practices.
That's
so
beautiful.
listen, please.
Love that. Love that. And what about you, Davine, what's your call to action? You're on mute, lovely.
Ooh. First and foremost, I would like all of the medical professionals from our doctors, PAs, nurses, I don't care what it is that you do, remember that you signed up to be in that position. So, and you're getting paid for such, remember that. I didn't put you in that position. You put yourself in that position. So treat it as such. When you was going to school for it, you knew what it required. So I know it's stressful, but being a patient is even more stressful for all of us. So each case, next thing I would like you to remember, each case is different. So please treat it as such and treat us as you would want to be treated. Or if your daughter was in there, or your mother or your brother, your sister, whatever, treat us as you would want to be treated. And remember, there's resources out there that you know of. Why aren't you sharing them with us? A call to action. I shouldn't have to be ringing the call button 3, 4, 5 times because it's a group of nurses sitting in there chatting. And you, oh, wait, I'll go in there a minute. Come to me now. Treat me the way that you want to be treated, period. And just because I have a skin color that you may not necessarily like, once again, remember, you signed up for this, not me, period.
Period. Period. I just want to end before I sort of wrap it. How much role do you think the color of your skin had to play in your experience? Let's start with Courtnee.
I believe mine was a twofold. Because I was young and a student, they automatically assumed I was stressed, like it was stress that was causing it on me, for me to not be moving, even though I told them I hit my head. Also, too, most definitely me being African American, the hospital that I went to is, the area around us is now predominantly African American. So I'm sure that medical professionals at that hospital have seen a lot. And people, they do, some people do, lie so they could get the medic. Like Daneen said, every person that comes in there is not the same as the other. And the way how I was treated in that hospital, I will never forget that, because it was the most horrific experience I will ever. I wouldn't want to see a family member ever go through that, or anyone go through that. Like I had experience with that. Just the automatic, like, oh, she's Black. So all of these things that, come with, whatever racial biases or whatever come with her, because I'm looking at her as a young African-American student.
Well, so that's a lot. That is a lot. Erica, how much do you think your race had to do with this?
I would say 50%. Because there was one particular time when I was at a hospital or a rehab center where I was only African American on the floor. Like, not only that, but only African American woman. It was like all males, so they were all Caucasian males, and so I'm the only African American on the floor. And I just think that certain times, whether it may be a look or a different, I don't know if I want to call it, well, like a look or something like that, or like it just like a little smart remark, something like that. I felt like it was just like, I felt like I was kind of prejudged, I guess, because maybe her fault per se, when it was not my fault. I was just an innocent bystander. But I think just a little bit prejudged. I would say 50-50. Overall.
Yeah, well, that's impactful. Davine, how much did your skin color have to do with the way do you think it had to do with the way you were treated?
I would have to say a lot. Not only me being a Black African American, one through and stayed with someone married, once they passed over a lot. And I should have and could have been treated. And now I'm finding out about a lot of resources that I should have been, that I'm entitled to. And now it's like I'm past the age of a lot.
Wow. And what about you, Davine?
Daneen or Davine?
Davine. Daneen. I'm so sorry, Daneen.
I love me some Davine, though. I'm just going to say
Me
it.
too.
I love you too.
Me too. And that necklace. That necklace is rocking it. But
yeah,
talking to Daneen. Go for it.
I will say wholeheartedly that my skin color and being a woman who had knowledge of the system played into my experience. They didn't like that I was educated. They didn't like that I asked questions. So I was put into an area where I couldn't ask questions. A call button would be removed. They didn't like that I had an advocate with me. And they definitely, I was not put in positions where I could get access to care and treatment for my brain injury until it was effectively diagnosed by someone who was of Asian descent and connected me with resources like PT and OT, and also supported me in saying, you can do this. Let me hear what it's like, what your experience is like now. And she asked finally the correct questions and gave me hope. So throughout the process, until I met this, my concussion doctor, I didn't have hope. And my concussion doctor, my gynecologist, were the only two people that really talked about relationships and what was it like to actually stand up and brush my teeth. Was they asked questions that were not on paper. What is it truly like to function and get up? And what's a day like for you? What does it feel like? What does it look like? Describe it to me. So with those deep questions, it gave me a connection for physical therapy so that they were able to incorporate movement, dance, art, and faith into my holistic care of treatment and planning. So I'm thankful for, I'm going to say Dr. Ward, I'm thankful for Dr. Beth Howe, who are amazing women.
I love that. Well, we're wrapping up, and I cannot tell you how much I love you, women. I cannot tell you how amazed I am at your tenacity and your courage. I cannot tell you how angry I am at how the medical profession that is meant to help and support because of the skin that you live in. I cannot tell you how disappointed I am at your medical system, right? That people are fighting for insurance that will help save lives. I am beside myself with rage at how these individuals who went through formal education, right, purportedly to help and to support, then judged you because of the skin that you walk in. I believe in naming names, and I love the fact that you all were very gracious and only named names of individuals who were actually very, very supportive. But I actually think sometimes accountability looks like naming the names of individuals, calling them up calling them in, individuals need to be held. For individuals with traumatic brain injury, is truth it firm, but still speaking truth, because this is such an important conversation that will, I know, profoundly impact the lives of other people. I want to thank you all.
Nneka,
Daneen
thank
Brooks.
you. I just want to go back to the chat. And in the chat, it sounds like this group of women are powerful. And we have someone in the room who says that they will make these suggestions, and they thank us for our words and just grateful for our voices. So I just wanted to share what's in the chat. So
That's beautiful. That's beautiful.
Together we are strong.
Yes, we are. So Daneen Brooks, Davine Mason, Courtnee Walker, Erica Renee Walker, thank you, my sisters. Stay strong, and we're here.
Thank you.
Thank you.
Thank you.